is that it's much less painful, less time in the much less time in the hospital, an easier recovery. So I think most people who are doing an incontinence procedures now tend to try and go through the vagina if at all possible, unless they have large fibroids or a large uterus that has to be removed at the same time. Then if you're already in the abdomen, you might as well do the incontinence surgery through the abdomen. That's how I kind of look at when a procedure should be done from above.
You know, when people always ask that question, you know, if they're going to invest in surgery, is it going to last and how long will it last? And I think, you know, we're operating on a part of the body that's changing. It's changing due to aging, due to the effects of gravity, due to the effects of estrogen, due to the possible removal of other organs in the area in the future. So, you know, what's tight enough and good enough support now might not be in 15 or 20 years. I tell patients, if an orthopedist puts two parts of a bone together, it's going to stay there for life probably. But, you know, if you try to set a sling at the right amount of tension to be just enough support now, how can you say 15 or 20 years that amount of support will be the same? But as Dr. Barnes says, you know, the success rates are good and they are durable in a reasonable, you know, amount of time. One question here from the audience is Ditropan XL a good medicine for incontinence? That's a good question. And, you know, that brings up the whole role. There's direct advertising now to you folks at home, the television commercials. In the past, you know, that wasn't accepted, that drug companies could reach you at home. They had to reach you through the doctor. Now you can come to the doctor and say, I've heard about Ditropan, and this lady sitting in the theater smiling, is it good for me? And that's a very good question. What's some of your feelings about the new medications that are available?
I think Ditropan XL at the dose of 10 milligrams a day works about the same as Detrol LA 4 milligrams a day. If I have a patient who has any type of neurologic problems or has really severe urge incontinence, I will usually recommend that they start on the Ditropan, because the Ditropan has different dosing. We can go up to 15 milligrams, we can go to 30 milligrams if necessary, whereas the Detrol LA is only really indicated for that strength, just the one time of 4 milligrams a day. And I think probably the reason that Detrol didn't really increase the dosing is because one of the things that they really thought was a strong point to their product is that they tried to say that it has less side effect than the Ditropan XL. And it depends on which study you look at. I think they both have about the same amount of side effects. It's possible that Detrol LA has a little bit less side effect. But again, if you start giving people twice the dose or 3 times the dose, like you can with Ditropan, then you're going to have more side effects. So Detrol, I think, has done a really good job with their advertising and keeping it a once a day, strictly one strength use, so that they really can brag that it has less side effects than the Ditropan, whereas the Ditropan can come in different strengths if needed and can be much more effective in people with neurologic problems or in people with really severe urge incontinence. So for all comers, they're both about the same, to tell you the truth, and they're both about the same price. They're both handy in that they're once a day, but again, I think they're both about the same, and I don't know what you found in your practice.
Yeah, I would tend to agree, except as you say, in people with underlying neurologic problems. Dr. Stern, how often do you prescribe these drugs when you see women in your practice?
I mean, not as frequently as you guys do, but I do when I have done some mild, some simple urodynamic studies, and I've found that it's less stress incontinence and more urge incontinence. I will try Detrol, and if it's not improved much, then
that's what we're finding too. Is that even a lot of internists, family medicine doctors can prescribe these medications, and oftentimes they're picking the right candidates empirically, and people do quite well with these medications. But as both of the doctors have mentioned, they do come with side effects, and you have to balance that against the problem itself. Any other questions?
As much water as we can, and of course on a golf course it's difficult. You just look to find yourself at the bathroom, and I find that it's wherever I see a bathroom I go, if I have to or not. So this becomes a mental problem. Like there's a bathroom, I better go now because I have to go later. Drinking with a lot of water, I think, is very important.
That's a good question. You know, a lot of people are urged to drink 8 ounce glasses of water a day, and if you add that up, it's about a half a gallon of water a day. And what are your thoughts about how much water people should drink? Here we are in Florida.
All right. It depends on the person. Again, I probably drink 2 glasses of fluid a day, and I